But Dr. Wang, I just want to go back to your earlier statement. There are 4 major treatments. Can you discuss each one of them?
Actually, surgery for cancer treatment is the most effective way. Sometimes, although it's mutilating, but it's very, very effective, especially during early stage. For late stage patient, it will not be possible to operate on. But sometimes we will still operate on to reduce the cancer burden in the patient's body. So also very effective.
So basically, for regular viewers, surgery is the modality where they really have to open that part and they remove the cancer.
Sometimes mutilating, like amputation. The second one I mentioned is radiation oncology.
And you are an expert in radiation oncology.
In this field.
Okay, what exactly is radiation oncology?
Radiation actually is a form of energy. And we use this energy to kill the cancer cells in the patient's body. And we have to be very precise. So that's rely on the new technologies. The new technology come out almost every day.
When you say energy, it's like a radiation. It's like probably it could be light or it could be laser, that passes through your body and then it hits the cancerous cells, correct?
Yeah.
Okay. This is one question, doctor. What if the radiation will also hit the other non-cancerous cells? What happens? Although you mentioned that it has to be precise so that the radiation therapy can only target the cancerous cells. How is that? How do you explain that, Dr. Wang?
Very good question. Yes. During our practice, we wanted to put the energy only in the cancer cell, but it's impossible. But we have ways to avoid the normal tissue or normal cells to receive less energy than the cancer cell. There are many, many modalities. So we have many, many options to avoid hitting the normal cell more and keep the most of the energy targeted into the cancer cell.
Wow, that's interesting. So, meaning for the regular patients who fear that even the non-cancerous cells will be affected by radiation therapy, there are now ways to avoid that.
Oh, yes.
So it has to be very targeted, it has to be very precise.
Yes.
And modern cancer hospital Guangzhou has that.
Yeah. We have the newest technology. The third treatment will be the chemotherapy.
Which is feared by many, correct? As a matter of fact, they say, again, I just voice this out because this is what we hear.
The side effects.
Yes, the side effects. It will make you look like me, you go bald, and a lot of things. So what exactly is chemotherapy and why is it also necessary as a treatment?
Yes, just like you said. Actually, every treatment modality is a two-sided sword. We treat the cancer with chemotherapy, but also the medicine can kill normal cells in our body. That will cause severe side effects. But for doctors, we have to balance the benefit of killing the cancer cells and the side effects of killing the normal cells. So sometimes we cannot rely only on the chemo, but we have to combine all the modalities together so we can reduce the chance of using chemo, but to help the patient with multiple modalities. So in that way, we can reduce the chemo. Also, there are some cancers can only be cured by chemo.
I see.
Yeah.
And the final treatment?
Yeah, the final treatment will be interventional treatment. The intervention means to do something upon something. Actually, surgery, radiation, and chemo are all interventions. But nowadays, we use interventional treatment to mean that we have to use tiny tools to help us to treat the cancer, like some special, very tiny catheters, tubes, or other probes. Nowadays, it is very, very effective. It really stands for the fourth pillar.